وحاليا ننتقل إلى الإعلان، مرحلة الإعلان عن البوسترات الفائزة. أولاً وأقول حق كل الطلبة اللي قدموا وشاركوا معنا مبروك وشكراً. ولكن عندنا لجنة تقييم وقامت باختيار الأفضل بوسترات لكل قسم. سوف نبدأ بقسم المعلوماتية وإدارة المعلومات الصحية. عندنا 3 بوسترات فائزة. البوستر الأول قامت بإعداده مجموعة من الطالبات وسوف تمثلهم اليوم على الهواء الطالبة وديان خلف، والتي سوف تنضم معنا حاليا. وأتمنى أولا أحب أقول لك يا وديان ألف مبروك، وأتمنى أنك تعطينا نبذة بسيطة عن البحث التي قمت به بحوالي دقيقة ونص. تفضلي يا وديان.
الله يبارك فيك دكتورة، جزاك خير. In Allied Health Faculty, we are motivating to improve the quality of patient life and support learning environment. As Allied Health students, we are educated and prepared to be an effective healthcare professionals and to support the healthcare organization. About our topic, we use the barriers of teleconsultation because of the rapid adoption of the teleconsultation program ensure access to and continuity of patient care while limiting exposure of COVID-19, and that have created unpredicted challenge that face the healthcare professional to provide service for patients in the outpatient clinic. Our finding that the most barriers of using teleconsultation, the outpatient clinic, that agreed by the healthcare professional are patient age and education level affects the teleconsultation access, internet connection that affect the quality of teleconsultation and lack of technical support. Teleconsultation also pose a risk to privacy between the professional and patients. Thank you for listening.
شكرا لك يا وديان، وأتمنى لك التوفيق من الأعلى إن شاء الله. الآن سوف ننتقل لقسم العلوم المختبرات الطبية. عندنا 3 winning posters فائزين، بوسترات 3 فازوا. أول بوستر قامت بإعداده الطالبة عنود الخالدي، ثم البوستر الثاني الفائز قامت بإعداده الطالبة منيرة الطيري. ومعانا حاليا الطالبة زينب كاوياني اللي فائزة بالبوستر الثالث. وحياك الله يا زينب، وأتمنى أنك تعطينا نبذة بسيطة عن البوستر. تفضلي.
Okay, thank you. I chose to write about Candida because it is one of the most common opportunistic pathogens isolated from the patients at the hospital, especially in the ICU. It can cause several types of diseases ranging from superficial to invasive, leading to increase in mortality rate. There are many challenges in diagnosing Candida. The gold standard method, which is the blood culture, is the main method in diagnosing, but its main obstacle is the delay till the results can be released, as it can take 5 to 7 days, which delay, on the other hand, the appropriate treatment for the patients. Even though this method is the gold standard, approved by the FDA and the most widely used, it still has limitations that cannot be controlled yet. Faster methods have been released, such as the serological methods. However, they also have their own limitations, as they are not approved by the FDA and cannot be used for clinical settings, but for research. More work is needed to evaluate and validate these methods for use as a rapid diagnostic test in a clinical setting for rapidly detecting and identifying Candida species, which could help in choosing the correct therapy and improve patient management. And thank you for listening.
شكرا لك يا زينب، ومبروك لك الفوز، وأتمنى لك التوفيق إن شاء الله.
شكرا أجمعين يا رب.
حياك الله. الآن سوف ننتقل للبوستر الفائز من قسم العلاج المهني. قام إعداد البوستر طالبتين وهما عايشة المطيري وشهد العجمي، وسوف تنضم إلينا الطالبة عايشة المطيري لإلقاء نبذة بسيطة عن بحثها. حياك الله يا عايشة.
الله يحييك. First, we examine the stress and the psychological well-being of mothers who are raising children with autism during the COVID-19 pandemic. And then we were able to determine the type of support that was needed. We used the socio-demographic questionnaire and the psychological well-being scale and the parental stress scale. In our findings, we found that mothers who reported they did not receive any support during the pandemic have experienced higher stress according to the parental stress scale. And using the psychological well-being scale, we found mothers who were unemployed, divorced, and perceived their family income as poor have scored lower in the psychological well-being. So these results show that mothers have experienced stress during the pandemic, and we found the importance of having family support, financial support, and employment during the pandemic.
شكرا يا عايشة. الصراحة بحث يعني متعلق بالوضع الحالي، وكذلك يتكلم عن موضوع وايد حساس، وجزاك الله خير على الأوتكم الجميل. حاليا سوف ننتقل للبروفيسور الفائز من القسم العلاج الطبيعي، وهو من إعداد مجموعة من الطلبة، وسوف تنوب عنهم حاليا الطالبة هند الخضيري. حياك الله يا هند معنا، وممكن تقدمي لنا نبذة عن البحث اللي قمتوا فيه.
Good afternoon, everyone. My name is Hind Al-Khadri, and I'll be representing my group and speaking on behalf of my colleagues, Altaf Al-Atiebi, Badriya Lihaya, and Maryam Al-Azmi. So, mental health disorders is a serious matter that is not widely talked about in Kuwait, which is what drove us to do this research. So, the aims of the study were to explore the prevalence of depression, anxiety, stress, and insomnia among healthcare workers, and as well as to investigate the common factors associated with them. So a cross-sectional study was conducted among 361 healthcare workers in both general and specialized hospitals in Kuwait, where they were asked to fill a 4-part questionnaire that included the depression, anxiety, stress scale, and the insomnia severity index. So according to the results, the findings were that the prevalence of depression, anxiety, and stress were moderate, while the prevalence of insomnia was high. And as for the factors that were significantly associated with those mental health disorders, they were young age, being single, non-Kuwaiti, lacking family support, having less years of experience, not exercising, being around someone who tested positive for COVID-19, as well as having to work both morning and night shifts. So as you can see, mental health disorders, they're on the rise and healthcare workers are at risk, which is why it is important to establish management programs and support programs, as well as to provide them with the required resources and educate the healthcare workers about their adverse effects. Finally, I would like to thank our mentor, Dr. Samira Al-Jadi, for her sincere efforts and hard work. We couldn't have done it without her. And as for the rest of my professors in the Department of Physical Therapy, thank you for making this past 4 years an amazing journey that has shaped me into the person I am today. And thank you.
شكرا لك وما قصرتي على الإطراء الجميل هذا. وأخيرا سوف نعلن الفائز الأول من قسم علوم الأشعة، وهو بوستر من إعداد مجموعة من الطلبة، وسوف تنوب عنهم الطالبة عائشة عبيد.
So briefly about our study, as everyone knows, the breast is a very, very sensitive area to radiation. So we always try to minimize the dose as much as possible. In our research, we studied how can we lower the dose to the breast in digital imaging and achieve an acceptable image quality. And for our study, we used the breast-shaped phantoms with different thicknesses. And alhamdulillah, we get a great result that we can achieve that. We can have a lower dose to the breast and good image quality to diagnose different pathologies. And inshallah, we will try to apply it in clinical setting on humans soon. Thank you so much.
شكرا لك يا عائشة وما قصرت.